Iron deficiency anemia is actually one of the most common nutritional issues in the entire world, but a lot of the time, it's kind of flying under the radar. So in this explainer, we're going to pull back the curtain on what it is, what to look for, and of course, how to treat it.
So let me ask you this, have you ever felt that kind of bone-deep tired, where no matter how much you sleep, you just can't shake it? I think we've all been there. And while, yeah, a lot of things can cause that, it also happens to be the #1 sign of an iron shortage. We're talking about more than just being tired here. It's a signal that your body's whole energy system is running on fumes.
To really get why that is, we've got to talk about something called hemoglobin. Okay, think of it like this. Your red blood cells are like this huge fleet of delivery trucks driving all over your body. Well, hemoglobin is the cargo space in those trucks. And the precious cargo they're carrying? It's oxygen.
So what do you need to build that all-important cargo space? You guessed it, iron. Iron is the absolute essential building block for hemoglobin. So if you don't have enough iron, you just can't make enough hemoglobin. And that creates a full-blown oxygen delivery crisis all throughout your body.
And that right there is the heart of the problem. Literally every single cell, from your brain down to your muscles, is counting on that oxygen to do its job. So when deliveries slow down, the whole system starts to lag and show some serious signs of strain.
So how exactly does your body tell you something's wrong? Well, here's the tricky part. The early signs can be super subtle. In fact, a lot of people have no idea they even have anemia until, boom, it pops up on a routine blood test.
But what's really fascinating is how all these different symptoms trace right back to that oxygen problem. That fatigue and weakness, that's your muscles basically starving for oxygen. Feeling short of breath, that's your body trying super hard to bring more oxygen in. Even pale skin is a sign, because you literally have fewer of those bright red blood cells. See, it's all connected.
And then there's one of the weirdest symptoms of them all, something called pica. This is a really strange craving to eat things that have zero nutritional value. We're talking about things like ice, dirt, or even paper. We don't know exactly why this happens, but it's a pretty specific signal that the body is seriously low on iron.
So why does this deficiency even happen in the first place? You might think it's just about what you're eating, but it's not always that simple. There are really 3 main ways your body can end up with an iron deficit.
Okay, so the first one is the most obvious. You're just not getting enough iron in your diet. Your body can't make its own iron, so it completely relies on you getting it from food. And during times when you're growing fast, like in childhood or during a pregnancy, your body's demand for iron just skyrockets, which makes your diet even more important.
The second major cause is blood loss. This is pretty straightforward. Since most of your body's iron is packed away inside your red blood cells, losing blood means you're losing iron. This could be from heavy periods or from something more hidden, like internal bleeding from a stomach ulcer.
And finally, we have the absorption problem. This is when the iron is getting into your body, but your system just can't seem to use it properly. Things like celiac disease or even certain surgeries like a gastric bypass can really mess with your body's ability to pull iron out of the food you eat, no matter how healthy your diet is. So this naturally leads to the question, who's most likely to be at risk? Well, certain groups are definitely more prone to this. We're talking about women of childbearing age, pregnant people, vegetarians who might have a tougher time getting enough iron, and, yep, even people who donate blood frequently. But here's the good news. Iron deficiency anemia is actually pretty easy to diagnose. The whole process usually just starts with a chat with your doctor and a couple of really standard tests. So the path to getting answers is really clear. First, you just talk to a doctor about your symptoms. They'll almost certainly order a basic blood test called a complete blood count, or CBC for short. If that test confirms you have anemia, the final, crucial step is figuring out why. What's the underlying cause so you can get the right treatment? So what's this CBC test telling your doctor? Well, it tells a really clear story using 2 main numbers: hematocrit, which is basically the percentage of your blood made up of red blood cells, and hemoglobin, which we already talked about. When you have iron deficiency anemia, both of these numbers are usually lower than the normal ranges you see here. Plus, the lab will often see that your red blood cells are smaller and paler than they should be. So once you have that diagnosis, the focus immediately shifts to getting those iron levels back up and, getting your energy back. And thankfully, the treatments are really effective. For most people, the fix starts with iron supplements. These little tablets are a direct and powerful way to restock your body's iron stores. Now, it's not a super quick fix. It can definitely take a few months to get back to normal. And it is absolutely vital that you do this with a doctor's guidance to make sure you're taking the right amount.
And of course, you can give your treatment a major boost with your diet. But here's the pro tip. It's not just about eating iron-rich foods like meat or beans or leafy greens. The real secret is to pair those foods with things that are high in vitamin C. Vitamin C dramatically helps your body absorb that iron. So think about having steak with a side of broccoli or throwing some strawberries on your spinach salad. It makes a huge difference.
Now, this is maybe the single most important piece of advice we can give you. Please, do not try to diagnose and treat this on your own. Because while iron is essential, taking too much of it can actually be toxic. It can cause all sorts of other problems, everything from constipation to serious liver damage. That's exactly why you need to work with a doctor.
So we'll just leave you with this final thought. If you've been battling that relentless fatigue, and if some of these other signs are sounding a little too familiar, it's a conversation that's really worth having. A simple blood test might just be the key to unlocking your energy and getting your life back on track.